everyone, welcome. It's Michaela Conley, HP CareerNet and Health Promotion Live, and actually today, State of Wellness. Thanks for being here. We've got quite a big crowd for a cold Thursday, although, you know, we've got Minnesota, so most of us have no room to talk. But thanks for being here. I'll introduce the presenter here in just a second. I have to tell you, though, Teresa Lovely was here and normally would be here on State of Wellness with me, and she had been here in D.C. with us because we had done a thing at the U.S. Chamber yesterday, and we realized that she planned her return flight during State of Wellness, and I was, kind of disappointed because I thought for sure that, it'd be fun to do State of Wellness together, and we could do like the, like the two women on Saturday Night Live who do the SNL or the public radio. I think it would have been a lot of fun. Well, at least for us. Anyway, so if you have questions, save them. Go ahead and type them in whenever you want. We'll probably save them all to the end, and we'll get through as many as we can. So today we have Minnesota, and we have Allison Faricy. Allison is the Worksite Wellness Coordinator and Tribal Liaison for Minnesota Department of Health. She has worked on a statewide health improvement program since it began in 2009. Since then, she has honed her skills and made many connections within the Worksite Wellness community, created healthy worksite. Creating healthy work sites is a professional mission of hers. She seeks to create culture and health. Geez, what is up with that? It must be the cold. She seeks to create a culture of health within work sites, mainly through policy, systems, and environmental change. A large percentage of an adult's time is spent at their work site, and she believes that it is an important arena for implementing strategies to keep people healthy. Boy, I'm sure glad it isn't any longer than that. I didn't realize that that you were a tribal liaison, and really that there were many tribes in Minnesota.
There are actually 11 tribes in Minnesota, and we have worked with 9 of them. And actually it's interesting because in northern Minnesota there are 7 Ojibwe tribes, and they all work together on one project for the past 2 years. So really collaborating, most of them for the first time.
Wow. Well, that's really awesome. What an opportunity to do good cross-cultural work. So
yeah,
okay.
It's been great.
So let me stop talking, and you can start talking. And welcome, Allison. I'm so glad that you're here.
Well, thank you so much, Michaela. And yes, I'm Allison, and I am just going to talk about some of the successes and some lessons learned that we've had in Worksite Wellness in Minnesota. First, talk about our particular approach to Worksite Wellness. The successes we've had in the first round of SHIP, which is the Statewide Health Improvement Program. The lessons learned and the changes that we've made for the second round of SHIP, which we are actually going into right now for 18 months. And then I will share some of the resources that we've found most helpful in our work. So as I said, I work for the Statewide Health Improvement Program, which helps people make the healthy choice, the easy choice, where they live, work, and play. And on the first slide, it states that working adults in the U.S. comprise 65% of the population 16 years and older, and then members of this group spend at least half their waking hours in the workplace. So obviously, some could argue that the health behaviors that you have at work are the most influential on your overall health, since you are there more than you are anywhere else, including home. So I think that worksite wellness is becoming very important. There's more and more, it's becoming more and more common, becoming more and more expected, I think, for younger generations coming into the workforce. And I think that research is showing that it really is an effective way to create healthy change and healthy behaviors in people. And then in the second slide, so in addition to the costs associated with health insurance, workers' health actually affects the profitability of American companies in really significant ways. So poor health of employees is correlated with a 51% decrease in overall productivity, so half the productivity is lost. And then that costs companies $225.8 billion annually, and that averages out to $16.85 per employee per year. So very significant costs that we're talking about. And that doesn't count the cost with long-term disability and workers' comp that employers also pay. So the next slide. For all these reasons, comprehensive worksite wellness is an important evidence-based shift strategy, and we employ the policy, systems, and environmental change approach to nutrition, physical activity, and smoking cessation. So it's a comprehensive strategy designed to improve the health of employees while reducing absenteeism and healthcare costs. And obviously our main goal is to improve the health of all Minnesotans, and for this in their work sites. But when we really sell this to both employers or funders or corporate partners or private sector or legislators, we also talk about the actually very significant healthcare costs, healthcare savings, excuse me. And then there's a link there if you're interested in reading more about that. So the next slide goes through some of the rationale, and again, just showing how effective comprehensive worksite wellness programs can be. Studies suggest that the return on investment for these programs is approximately $3 to $6 saved for every dollar spent. And this is shown in reduced obesity and tobacco use, improved productivity, and lowered absenteeism, as well as lowered healthcare costs for employers and employees. So very significant savings there when you really used that evidence-based approach to worksite wellness. So I just want to talk just a little bit about our PSE approach, and I know that this is what a lot of people are doing, but we really focus on having a policy, system, and environmental change all in place in work sites. So a policy, it could be a policy, it could be changes to a law and ordinance. Talking again about working with the tribal communities, they often have different languages, you know, they have different governmental structures, so often it's a resolution or a mandate or a regulation. Whatever works in people's communities is what we like to see happen. And then systems changes, we look at really the kind of the change in culture, the change that happens throughout an entire workplace system. Maybe it's a hospital system with many hospitals, many work sites, kind of a system-wide change. And then environmental change, which is like a physical change, maybe trailheads or maybe bike racks, different things that actually change the physical environment of the work site. So then I want to talk about the first 2 years of SHIP and some of the successes that we saw with worksites, some of the things that we found to be most successful. So on the next slide, there's a pie chart, and it gives a breakdown of all the worksite-based activities that we offered and what happened. So you can see, and these changes, these numbers, include either policies, systems changes, or environmental changes that were made as a result of SHIP. So there were 870 comprehensive worksite wellness programs established, and this is across the state. So this is through 87 counties and the 9 tribal governments. So obviously this is affecting many worksites and many people, and that's the comprehensive approach which touched on obesity and tobacco. And then we had active worksites at 273 changes was the second most popular. And that could be a physical activity policy to not schedule meetings over lunch so that people can be active over lunch, environmental changes to make it easier to bike or walk to work, access to facilities, so maybe classes that were offered or time that was offered to be active during the workday, walking meetings, whatever that may be. Then Hennepin County Health Works had 104 changes. Connection to cessation services was also really up there at 94. You know, we tell people to quit smoking, and there is a quit line, a state quit line, but really that connection to cessation services, whether it's getting the nicotine replacement therapy or getting some counseling for people, really connecting them to the most effective methods of smoking cessation. Then we have Healthy eating, tobacco-free grounds, and breastfeeding are kind of the last ones. And healthy eating was picked quite a bit less than active work sites, and I think part of that is due to the fact that sometimes the nutrition and food is outsourced, so it's not really under a work site's control. You know, they hire a company to do the cafeteria, so it's just kind of another layer that you have to go through. And then breastfeeding support was fairly low. I think it is gaining momentum in the state, and I'll touch on that a little bit later as well. And then tobacco-free grounds were a little bit lower as well. But our grantees who did work on tobacco-free grounds were very successful, so that was great to see, especially in the post-secondary schools. So we have, for Worksite Wellness, we had by far the most people, this is the next slide, I'm sorry, working on comprehensive Worksite Wellness. And then we broke down obesity into, we consider nutrition and physical activity obesity, and then there's tobacco. So we consider those the two big risk factors. So what I want to talk about now are some of our communities that were funded through SHIP in the first round, which was 2 years. And some of the successes that these communities had and the strategies that they used to be successful. So the first one was a county, and the next slide talks about Benton County and Coborns Incorporated, and that is a grocery store, and which is the main grocery store in this Benton County. It's a bit rural, so they don't have many grocery stores. And what they did, and it's a big employer in the county, and what they did was made a decision to implement a tobacco-free worksite policy. So they transitioned 6,500 employees at 80 different locations across six states. So it was a very large initiative. And as of today, policy implementation has gone smoothly. So this is really important for work sites where it's the norm, it's the culture that people smoke, and even if you don't smoke, there's probably one place to take breaks. There's probably a break room, and it's probably smoky. If someone's not smoking there, they recently have, so you're getting either the secondhand or the third-hand smoke. And that's, you know, that's not your decision, and that's somewhere that you have to go every day to work. So that was something that we were really happy to see Benton County be a part of. The next slide talks about another collaborator that we have, Lincoln Lyon Murray Pipestone. So they had a service co-op, and they decided to put a comprehensive worksite wellness program in place. And to enhance their program, they are in the process of implementing a healthy catering policy. So that will affect not only their employees, but the customer they serve. So what they did was they trained the staff who orders the food in healthy food to be ordered, healthy choices to be made there. So the food itself that's coming in is healthier. Then they trained the catering staff on also what foods to choose, how to choose the freshest foods, and also food preparation. So the food itself is of higher quality, the food preparation is healthier, and this food feeds the employees and also is sold in the co-op. So this really affects, it's an example of a work site, but it really affects a large percentage of people, because not only the people who work there, but anyone who shops there. So it was written into policy, so it's a policy that this is where they buy food, and these are the standards that they use to choose the food that they purchase, and then these are the food preparation techniques that they employ. So this will be sustainable by the guidelines in the policy, and then it's written into the training manual that's provided to the current and the new caterers. So whenever there's turnover, the new people will come in, and the training manual will state this is where you buy the food, this is how you prepare the food. So it's a very sustainable change that's been made and affects really a lot of people. So that was a great change to see as well. Then we have Meeker McLeod Sibley on the next slide, another grantee. And they identified 8 work sites. They identified lead individuals and the internal SHIP team to carry out goals and objectives of their individual work sites. So this is just an example of something that we found very, very important in the first round of shift, we required them to have community leadership teams. And these teams became so integral to success of the grantee. They basically consisted of someone from each sector that we wanted to see work done in, and those were schools, community work sites, and healthcare. And then someone from each content expert area. So someone who is an expert in nutrition, someone in physical activity, and then someone in tobacco. And we also like to see, members of the community who are particularly interested, members of school boards, large employers in the area, maybe someone involved in local politics, anyone that would really help to be a champion in the community and promote buy-in. And hopefully these people would have an interest in this and have a passion in making their community healthier. And in that way, when these people are chosen and they come together, we actually have seen that, unfortunately, we had a 70% cut in our program for this next round. So we couldn't fund all the communities that we funded in the last round, unfortunately. But what we've found out is that some of these community leadership teams are still meeting. They still want to meet. It's been a sustainable part of their community, and these people are still involved, they're still engaged, and they are still really motivated to make their communities healthier places, even without any funding. So that, we found, is a very important part of the community buy-in and the success of the grantee. So this was just an example of that, and people will continue to meet. And then the next slide talks about North Country, and this is a 7-county collaborative in northern rural Minnesota. And they worked in 3 work sites in their region. And what they did, and what a lot of our grantees have done, is they didn't have a lot of internal capacity with worksite health. So they contract out with Blue Cross Blue Shield of Minnesota, who has a great worksite wellness consulting program. And then they work with our grantees to not only build their own capacity and their knowledge and skills in working in worksite health, but they really engage different communities, engage different business owners to really follow kind of the standards that we found to be the best practice in worksite wellness and the evidence-based practices. So they go into each worksite, they completed their assessment, they convene the wellness committees in each site, and then they develop visions and goal statements. So we found those to be really, really important steps as well. And then this next example is Upper Sioux on the next slide, and this is one of the tribes we work with. So when we said you need to work in worksite wellness, they said, well, we have a really, really tiny community. It's on the reservation. Really, it's just our casino. That would be our main work site. So we said, okay. And they said there's no way they're going to change their eating behavior. It's a casino. You can smoke in there. People like their Philly cheesesteak sandwiches and have a smoke and go gamble. They don't want to see change. It's going to be really difficult. So we were trying to troubleshoot with the coordinator, Candace, there, and we said, well, what about the vending machine? And she said, oh, yeah, many people in the community work at the casino. Many of them eat out of the vending machine. So they didn't want to see their favorite items go away. They were really against that as a result of an assessment that we did. So we said, well, what if we just add healthy items? So she ended up just being at the casino when the vending company made their delivery and just had a really casual conversation and said, you know what, it would be really great if we could add granola bars and yogurt and apples and milk and some low-sugar juice to this vending machine, and just have it be, don't have it be more expensive than the other foods, and just see how it goes. And if it doesn't sell well, you don't have to keep it. So the guy put it in, and it turns out that those items are really popular, and they actually now have added more items on their cafeteria line that are healthier, and now we're working on menu labeling because it's been such a success. And people love it so much, employees love it, and then patrons of the casino also love it. So this has been a huge kind of unexpected success for Upper Sioux in their worksite that affects probably about 50% of their community that works in some capacity in the casino and eats at either the cafeteria or through the vending machines. And then you have everyone who either works in a cafeteria where the menu labeling is currently going on, or anyone who goes to eat at the casino, which is also a large percentage of the community. So they've had a lot of success, and it happened with just really just a simple conversation. So sometimes you have to go through all the channels, and sometimes it's just really a conversation with someone, and who knows if the person who was stocking the vending machines, if they had an investment in healthy eating, if they really cared, or if they were just willing to make a change because she asked nicely. But the bottom line is it became really popular and it led to other changes. It's been very successful. So the next example is, it's pretty similar to one of the other examples. The next slide talks about Cottonwood Jackson, another collaborative. They're also working with Blue Cross Blue Shield. And a big part of their work was developing communication and messaging to their community. So what they did was they have a couple big employers in their communities, a healthcare employer and a manufacturing employer, and they wanted some press that they were offering healthy work sites. And so they had some radio ads, and they had the local paper that circulated, and they really wanted some messaging about that to get kind of the good vibes going through the community. And they felt that that would be really helpful in their community, that would really speak to the members of the community who live there. And it has been. It's been it's been a buzz in the community. It's been written up. It's been in the paper. And it's so, and they knew that the local public health knew that that's what would get people on board in their community if there was a buzz about the new healthier workplaces. And then other workplaces have actually contacted them saying, we want to be a part of this. We want to make these healthy changes in our work site too, and then we want some press. We want people to know that we're doing this comprehensive approach to worksite wellness as well. And then the next example I have is Anoka, and what they did was really different. They had a partnership with local public health, the private sector, including some health plans, some champion citizens, and MIPPH. And what they did was bond together to form a working group, and they actually developed eatwellworkwell.org. And what it is a website that has sample policy systems and environmental changes. But when you go on there, you can read about food at work. You can read about the rationale for why they do this. You can download sample policies they have for example, catering policies for catering at work, or vending machine policies, or physical activity policies, or smoke-free grounds policies. There's an education and tools tab where you can educate partners to why they would want to take part in these things, or educate business owners or HR departments with why this would be beneficial for them to do these changes. And then there's a link to resources. So it's been a really good example of a very non-traditional public-private partnership that's really developed into something that helps the whole community, and it's a great resource to use. So it's there on eatwellworkwell.org. So the last example I have from our first round of SHIP is the Otter Tail Golden Start Initiative, and they are part of a 4-state collaborative to work on breastfeeding and work on a baby-friendly hospital initiatives. And what they've done is in different work sites, they renovate the rooms, they have pumps in there for use, they educate employers and also all employees about the importance of breastfeeding, and then the importance of supporting breastfeeding mothers during work, because I think it's hard, especially in certain situations, if you have, for example, an office or even a non-traditional work site, a manufacturing area where it's hard to find, first of all, the room to breastfeed. Second of all, it's hard to take breaks, and people wonder why you're getting those breaks. So education is a really big part of breastfeeding initiatives, whether it's educating the employer or educating fellow employees. So what they've done is make it a part of employee orientation, and also something that we're working on statewide is a worksite recognition program for breastfeeding. So this would employ some of the steps of the baby-friendly hospital initiatives. Obviously not all of them are going to apply to work sites, but having a space reserved only for breastfeeding, not a bathroom or a room that's used for anything else. having it be a comfortable space for women, having pumps for youth, having the breaks established and communicated, and then having it be part of employee education and orientation so that everyone is on board and everyone understands the importance. And with the Worksite Recognition Program, employers would apply online through MDH. They would have to meet these criteria. Then they would get a certificate and also get some press and also be listed on our website as being healthy, baby-friendly work sites. And then they would have to renew annually just to make sure that they were still meeting the criteria. So that's something that we're working on statewide that we hope to implement over the next year or so. So the next two slides just go over healthy eating by intervention, and basically our evaluation team just counted up the practices that have changed, if there was both a practice and a policy, if there was just a policy, or if there was an environmental change. And excuse the codes along the bottom. Those are actually codes for our different strategies or interventions. But it just goes to show you that you can make hundreds and hundreds of changes. And some of them are policies, and we like to see policies because we feel like that's very strong and very sustainable. But sometimes it's just a practice that's changed, and a policy, a written policy, or a formal policy just isn't going to accompany that. But as long as the practice changes, the norm changes along with that. So ideally we'd like to see both, but sometimes it's just a practice that changes. And then that's fine too. So the next slide talks about the SHIP approach. So the SHIP approach to comprehensive worksite wellness aims to reduce the risk of chronic disease by supporting changes that improve nutrition, increase physical activity, and support tobacco cessation and a tobacco-free environment among employees. So we did a lot of assessment and we did a lot of evaluation of our first two rounds of SHIP, and we had a lot of success in work sites. However, we did have quite a few work sites where we required two changes, and maybe, for example, someone switched out a couple items in a vending machine and then they put signs up on a walking trail. Well, that didn't actually do much to change the system at work, to change the norms, to change the culture, because some people never accessed the vending machines, so they didn't really know about that. Or maybe on the walking trails, people don't really have time. They don't take the time to do that. There's not a physical activity policy in place, so they would never go on walking trails at work. So what we found was that the way we did it before was having them just choose two strategies, but they didn't have to have any connection to each other and didn't have to have anything complementing them, wasn't really changing the culture of work sites as much as we had thought or hoped. So we really changed it up for this next round of SHIP. And this was based on a lot of research that we did and found the best practices so we could do the most evidence-based best practice for worksite wellness. And we also contracted with the Wisconsin Department of Health to see what they were doing, because we knew that they were very successful and we wanted to find out more about their approach and how successful they were in really changing the culture of work sites, which really lead to that long-term sustainable change. So the next slide talks about the objectives of SHIP 2.0, for lack of a better word. That's what we've been calling it internally, and so that's what I'll refer to as the second round of SHIP funding that we have. The objectives are to create an organizational culture of wellness and reduce healthcare costs. Lessons learned from the previous 2 years of SHIP are the public-private partnerships, as well as emerging research revealed that worksite wellness initiatives addressing the healthy food, physical activity, and tobacco-free environments are most effective when implemented comprehensively. So what we did was we changed the worksite approach to be really rather rigorous, but also complementary. So the next slide shows the strategy that our grantees were able to choose from. The first column going down is the nutrition strategy. So they could work on vending, cafeteria, catering, or breastfeeding for nutrition. And another decision we made was, instead of having breastfeeding be its own strategy, we just put it into a nutritional strategy, since we feel it's the first nutritional strategy for the baby and also a nutritional strategy for the mom. So instead of separating it out so it was seen as this other thing, we just included it so people will start to see that it's just a nutrition strategy, just like a healthy catering policy, a breastfeeding policy improves nutrition. So going over the next column, we have the physical activity choices. Grantees could choose active transportation or increased access to facilities. And then for tobacco, our tobacco staff really did a lot of research and really looked into best practices and decided that tobacco-free worksite policies were going to be the most effective and going to be the best bet for us to show healthcare costs so that we could secure future funding. Our evaluation team, going to the next slide, they also decided that if we could show certain concrete outcomes, we would be more likely to receive more money and also just really show concretely what's happening, what we're doing, because this will be 4 years of work, and we wanted to really have some outcomes to say we really are improving the health of Minnesotans. So they decided that evaluation measures that have to be written into work plans are policy systems and environmental changes, and then health risks and behavior changes. So changes in health risk behaviors, changes in behavior, that could be increased fruit and vegetable intake or increased minutes of physical activity per day, for example. And then the third one was cost savings. We are working on trying to show actual healthcare cost savings, which, as you know, in 4 years is pretty difficult, but we're trying to draw some conclusions there. So I know our evaluation team is working very hard on that. And just to talk about our approach, so we have the three-pronged approach where we're using policy, systems, and instead of or policy environment, and instead of saying systems changes, we're calling it social support for worksite. And we're actually, in this round of SHIP, from the evidence, from all the research, we're requiring that for nutrition, for physical activity, and for tobacco, for each one, there's a policy in place, an environmental change, and a social support. So we're really asking them to do 9 things, which at first sounds like a lot, but when you consider that they're really complementary, it really isn't as much. So I'll go through an example just to clarify. So an example of, we'll go with physical activity. So for physical activity, they need 3 changes. So a policy might be, and this is that next slide, implement a written policy that allows and encourages staff to walk over the noon hour. So this would be no meetings are scheduled over the noon hour. If you see someone walk, you're allowed to use that time for physical activity. This is part of your paid time. It's not a break that you're taking. This is a policy that the worksite will adapt. The environmental change that complements that policy is mapping distances and routes for walking near the worksite and posting the distances maps in conspicuous places. So this is saying, okay, you have 20 minutes to walk. Well, here's a route that's half a mile. So here you can go do this, or if you have a longer time, you can walk this, or if you're having a walking meeting, if that's something that you do at your worksite, here's a mile route. So this changes the physical environment with the signage and gives information with the mileage and different routes. And it supports that policy of saying, you know, we're encouraging you and allowing you to walk over the noon hour. So then we have our social support piece, which really is kind of more similar to the kind of old way of doing things, the programmatic approach or the engagement. But it would be maybe like us conducting a 6-week walking campaign that tracks step or mileage, or, you know, a contest where people do the walk to Key West, or those kind of challenges. So that would be the engagement piece. So if a grantee was doing this, we would say, okay, great, get the policy in place, and then let's have this walking challenge, and let's use that to engage everyone, have a little fun, because people love these walking challenges. We've learned that although people don't tend to stay active after the walking challenge, and they don't tend to be very effective, people love them. So let's do that. Let's use that to get engaged. Then let's really communicate that there's a policy in place, and let's change the environment to make that easier for people to do. So that's what we mean by 3 changes for each. So that's 3 changes for physical activity in the worksite. So hopefully that's clear. And then I just want to go through the steps that we've found to be most effective and really important when we're talking about creating worksite wellness. So the next slide talks about steps in the process. One is recruit partner organizations. So a grantee would really develop a list of area employers, small businesses, maybe other governments, schools, hospitals can also be work sites, even though we also require grantees to work in school, health clinics. Engage an existing network of partners. Now sometimes grantees would engage, have plans in mind to engage certain partners, but they weren't as open as others, so we say, okay, cross them off the list for now. Once it starts becoming more and more common to have comprehensive wellness, you may want to see if they're interested in getting on board again, but for now, it's really important to recruit partners who are really interested in your cause. You can also contact human resources staff or community partner specialists, and in-person meetings we found are especially effective. So second, and a really, really important step, is to convene a wellness committee. So facilitating the formation of a wellness committee at each of the participating work sites. And then the next sentence says, wellness committees markedly increase the success of the implementation and sustainability. And this is especially true, we found, if there's a member of leadership on the wellness committee. And this is because that actually gives the wellness committee some clout. It actually gives them some power. It actually gives them some decision-making power so that they feel like they've got some buy-in and they feel like they can actually make changes, not just think of something, but then they have to bring it through leadership and they might not be engaged. So we found that wellness committees, while very important, become much more powerful if there's at least one member of leadership on board. And also it talks about how members may include executive champions, also human resource representative or manager, and then just employees who are your champions. Those are going to be very important for you too. So the third thing that we found to be crucial is conduct a baseline assessment. And this, the same, simple 4 or 5 question assessment can be used in each site, but we found that some grantees had an idea, well, we really want to do healthy vending policies. And they would go into a work site, and the work site would say, I don't know that anyone uses the vending. I don't really know that that fits into our work site culture very well. So it's really important to do an assessment and say, what do you think is important? What do your employees want to see changed? And also, what is feasible for you to be changed? There could be something. There could be that people really want that physical activity break policy. Employees are really excited about that. They really want it. But if you know from your assessment, you know from your meetings that that's not really going to be feasible with management, without the support, it's really not going to happen, then that's not the best strategy to choose. So it really needs to be the engagement and then also the feasibility. So each site having an assessment, using that assessment to drive the decisions, and then making the work plans according to that. And the fourth one is really developing really detailed action plans. This is something that we require of all grantees, and moving forward we're going to require any changes that be made really be updated to those work plans. And what we found is that a really detailed, well thought out work plan can really drive and keep the strategy moving forward. It should have goals and objectives, it should have action steps, who is responsible, a timeline, technical assistance needs that they may know they need or that may pop up, so that we as the state can help them or we can connect them to others who can help them, and then what they're measuring. How are they measuring the outcome? Are they doing a pre-post fruit and vegetable consumption survey? Are they doing a sales data survey? Are they talking with cafeteria staff anecdotally? Are they surveying employees? How are they really measuring if this change was successful and if this change is actually leading to health behavior change, which is our ultimate goal? So the next slide, I don't know if you can see this, and I apologize for it being so small, but this is just an example of what our grantees see in our Worksite Wellness Guide. They first pick that policy in the left-hand column, then they choose an environmental support, any one, and then a social support. So another example, enacting an overarching policy to provide healthy food options in the cafeteria, vendoring, and snack boxes. So that's the policy that's required. Then they can go to environmental support. What would work best in their work site, and they choose whichever one they think would work best. They choose it as a result of the assessments. And sometimes it's trial and error. Sometimes they choose one, it doesn't work well, they go with another one. They can also choose more than one environmental support. I know that E3 here says offer local fruits and vegetables at the work site, i.e. farmers market or community supported agriculture drop-off point. And just anecdotally, I know that in our building we have a lobby shop where most people go to get coffee or some food. It's kind of like just a tiny convenience store. But what they did was work with the local farmers market to once a week bring in fruits and vegetables. And after a while they said, you know, it's selling, but I wish we could do more. So what they did was at the checkout they had a request list where we could write down, you know, I really wish that you had squash. I really wish that you had more tomatoes. So people would put in requests, and then that's what they would order from the farmers market. And then every week they have all the items for sale, and it's been very successful. And you walk around and you see these fruits and vegetables on everyone's desk, and you see different things that you might not have had access to during the workday, and it's just been wonderful. So that would be an environmental change that supports the policy. And then you pick the social support, whether it's sending healthy food messages to employees via multiple means like emails, posters, payroll. I know most people have posters up around their work site. Emails can be effective, but I know that, you know, I think we all have 5,000 emails a day, so especially with attachments, those can be hard. An intranet is a good way to kind of update employee information, or even just something like a blurb that's read at staff meetings by managers, whatever it is to kind of communicate that. Or taste test. Something that our grantees have found to be very effective is taste testing. Maybe it's pomegranates in season. Maybe it's different fruits and vegetables that are in season that maybe people haven't tried before, which can be apricots, whatever it is. They have taste tests. And it doesn't, you know, it doesn't take a lot of time, it doesn't take a lot of money, but it introduces people to new produce, and then they're more likely to try that or buy that or feed it to their family. So it really is kind of a fun, social support. The social support is kind of the fun aspect of these strategies. So that's just an example of what our grantees are doing in this round that we feel is really going to be very effective in eventually changing those health behaviors and showing healthcare costs and just creating healthier work environments, which is really our goal. So my last slide just lists a couple of the big resources. The Wisconsin Department of Health and the Wisconsin Wellness Resource Kit, and our worksite guide is actually developed closely from this as well. And then that eatwellworkwell.org site that I mentioned earlier that was developed by one of our grantees through the public-private partnership. And it looks like I did not put our website, the SHIP website, on there, so I can certainly get that out to Michael or get that out to everyone. But it's the Statewide Health Improvement Program here in Minnesota. So that is all. Any questions for me?
Sorry about that. I had to quickly unmute my microphone.
Oh, that's okay.
I didn't leave you or anything.
Okay, good.
So yeah, so that was really great. So if you have questions, please type them into the box, or if you're a crazy brave person, then I can unmute your microphone if you want to raise your hand. Yeah, that was really good. Sounds like you've been having some really good success up there.
Yeah, we really have. We're really excited about, I mean, I think the first 2 years, a lot of our grantees were in the planning stage for 3, 6, or 9 months. So it took a while to get things off the ground, but now we're very excited for this next round because everyone is off and running. They have their wellness councils. They have their community leadership teams. They're ready to really take it to the next level. And that's why we really debated about this approach with the policy, environmental change, and social support needed for physical activity, nutrition, and tobacco. We thought, well, that's 9 different things. But we thought, you know what, they've been preparing for 2 years for this. We'll give them examples. We'll lay it out on a table, and then we'll help them. So I think they're ready for it. So we're giving it a go. Great.
So I wonder, I suspect I know the answer to this, but who knows? I wonder, is your outreach sort of crossing artificial boundaries within the Department of Public Health? And are, like, for example, are the schools getting any benefit from all this great stuff you're doing?
Absolutely, and I've just talked about work sites, but we also have very similar strategies going on in schools. We did not require this rigorous approach in schools, but we did recommend it. We just thought that it would be a little bit harder because you've got school boards to go through. You just have a little more layer to go through there.
Mm-hmm.
But we did recommend that they do the three-pronged approach in schools as well. And then what a lot of people have done is actually use schools as work sites. So they've got the school interventions going on that affect the children, the active school day, or the healthy lunch and snack policies. And then they've used the school as a work site so that they've made the healthier changes for the teachers and the staff. Mm-hmm. So everything really complements each other to be this really healthy environment for everyone then.
Yeah, that's awesome, because I think it's such a growth area to really think of schools. I mean, certainly workplace health promotion has existed in schools, but to sort of think about that as almost a segue to reaching those kids whose, parents are employed.
Exactly. And some of the school interventions actually, part of them, a detail is that they have some education for the parents as well, whether it's food prep or taste tests or them coming in. So it affects the staff, it affects the school, it affects the families that attend the school. So it really kind of goes into all the fingers of the community, which is eventually what we'd like to see.
Yeah.
And one of our staff members says, wouldn't it be great if a child goes to school and they say, I learned about this vegetable and all the properties and how important this is and how healthy it is, and I tasted it today at school. And then someone says, you know what? The parent says, I did the same thing at work today. They did that for me. So eventually that's what we'd like to see.
Yeah. Super. Okay, well, we have a couple questions. Leah wants to know, can we access the menu of strategy choices available to grantees as shown on the previous slide?
I believe that has recently been posted. I can check and then send a link. Would I send that to you, Michaela?
Yeah, you can send it to me, and I can make sure that it's posted with the archives and the slides and all that.
I will send that. We have just been revising them and just been putting them in their final form, but I will definitely send that, and then you can access them. Because yes, it's we worked very hard on the guides to change them. They were these huge monster documents, and now I feel that they're really user-friendly and really can be a resource for other states or other communities because they're really applicable to different areas.
Yeah, great. Yeah, that's the thing that I think I love most about, sort of the whole state of wellness thing is everybody, all the resources, people are just like, take them, use them. We created them.
Yeah.
We want to share.
Right, definitely, definitely.
Yeah. So here's Mary who's wondering, can you talk about the role of health communication in worksite wellness? I specialize in health literacy as it relates to health promotion. It seems that communication efforts would come under the social support area. And who does that work?
Good question. We have a communication staff in we're in an office, the Office of Statewide Health Improvement, and then we have this is the largest grant program in the office, and we have a communications team, and we're really working to have a more comprehensive communications plan. It's been a whirlwind for the first couple years of SHIP. We've had a newsletter that went out to communities, but we really want to have more branding. What we realized is that when we were trying to get more funding, so many people didn't know what SHIP was, and it was maybe in their children's school or it was in their work site, but they didn't know what it was. And we thought, you know what, we really need to make it known what we're doing and let people know that this is going on and this is a positive thing. So we're working with our communications team. I would have to say that the plan is not fully developed yet. But what we're also doing is we've created this partnership with Alliance for a Healthier Minnesota. And I don't know if other states have something similar, but this is a group of, basically a group of business people who just have an interest in health and improving the health in work sites. And they have a lot of PR. They have a lot of visibility in the state. They actually put on this Biggest Loser Minnesota, which is after the show, Biggest Loser. And they market it to all work sites. Thousands of people participate. Really big companies like Target are involved. In Minnesota, Target, Best Buy, General Mills are all involved in this. And many work sites offer this. You can compete. You have teams. So they really use that as an engagement and also an education tool. When you log on every day, there's like a tip from an expert and tips on how to be more physically active if you're trying to, increase your team's activity. If you have to log your fruit and vegetable and fiber and other intake. So it talks about, how to have a healthier diet. So it's an engagement tool, but it also has a large education piece. So we really partnered with them last time for that engagement, even though we're kind of, we don't want that to be the main goal of our grantees. We really want them to work on those policy and environmental changes. But for visibility, we partnered with them, and we will do that again this year.
Great. Let's see. I think it's actually a different Mary. So many Marys, so little time, would we be able to see an example of a worksite policy that allows people to walk on the clock?
I'm wondering if, and I don't have it right here, but on eatwellworkwell.org, they do have just sample physical activity policies that you can just download, and the language is there, written and everything.
Oh, great. Eatwellworkwell.org,
and it's listed on the last slide.
Yep, I see it. Okay, so yeah, what a great resource to have some sort of policy templates. Yeah.
Exactly. And these are very established policies. These people actually worked with the Public Health Law Center, who we contract with, to help our grantees write policies and write resolutions. So very strong policies.
Oh, great. Yeah, I bet there's probably sounds like there's some really good stuff there.
Definitely. It's a great resource.
Yeah. Sarah wants to know, how involved have universities and college been in this initiative?
Good question. We actually, the main involvement that they've had is we had a very successful tobacco-free post-secondary campus, and that's actually, and I don't have the number, I wish I had the number in my head right now of how many campuses actually went smoke-free, but it was very successful for the first round of SHIP. We have a great tobacco staff that has a lot of experience in engaging this. We put that in schools. So it's part of the schools initiative, and then schools are required. So it's part of what's required now for grantees, and there's a lot of capacity around the state. We also, our grantees work a lot with American Lung Association and Answer to kind of, and smoke-free communities to help with this work. So there's been quite a bit. I would say less have been chosen as work sites. I don't know actually that any have been chosen as work sites, even though we do have a lot of post-secondary schools. So we're hoping to see more of that in the next round, and more of that kind of comprehensive approach like I was talking about, like the tobacco-free post-secondary campus, and then let's use it as a school intervention, and then let's use it as a worksite intervention as well.
Super.
So hopefully there will be more.
Yeah. Janie says, Eat Well, Work Well posts sample policies on nutrition only. Nothing available on physical activity.
Okay. I will check if Public Health Law Center might have some sample policies.
Yeah, just email that to me. I'll make sure it gets out there so that everybody can check it out.
Yeah, because I know they provided templates.
That's great. And is that something specifically to Minnesota, or is that a national thing?
The Public Health Law Center is just in Minnesota, but they do work on policies and language that could be implemented other places.
Great. Well, you're so lucky to have it there.
Oh, it's amazing. Yeah, they've been a great partner.
Yeah. Well, great. I think we've answered all their questions, and I can let you go back to probably your hand warmers. What's the temperature there today?
A -11.
Oh, that is so brutal.
It is.
When I left Indiana, I I was going to either move to Seattle, Minnesota, or the DC area. I decided Seattle, total sinus headache. Minnesota, I would freeze to death. So, you know, here I am in DC. But but you've got a beautiful place to live if you can just survive the winter.
Yes, it's beautiful in the summer,
Yeah.
in spring and fall.
So, well, thanks so much for being here.
Thank you very much.
Great information. Really appreciate you taking the time to share it with us. And I guess for everybody else, you know, come. Thanks for being here. Come back tomorrow. If I could think quicker, I would have been ready to tell you who we have tomorrow. It is
Sean Connors.
Oh, thank you, Kelly. Kelly is so good. She's just right there. You don't have to call her. She just like intuits this stuff. So, will you take care? Have a good weekend, and I'll
Thank
see
you.
guys
You too.
all real soon. Take care. Bye bye.
Thank you very much.
You're welcome. Bye bye.
Bye.